I was diagnosed with scoliosis in July of 2024. We noticed that my hips were out of line and that one of my hips, I had no hip on one side and then my other hip was further out than the other. So we went to the chiropractor and they took an x-ray because they saw that I was leaning over to one side. And that was when I first got diagnosed, but they said it was 48 degrees, but we decided that we need to treat it, so we came to Dr. Tony Nalda's, and he did another x-ray, and it turned out to be 56 degrees. The pain was definitely quite intense, and it wasn't really hard to do things, but just knowing that I did have it was just kind of heavy. It was a lot of just almost pounding, and it was just always there for a while, and it was just like a big weight on my back.
Scoliosis in younger patients and adolescents growing and developing normally doesn't have a lot of physical effects in terms of pain or functional impairment. Meaning normally it's what they see. They can see it, and you can see Sophia talks about how she was shifted and there's a postural change, and you see this postural alignment that normally brings on the diagnosis. However, 5% of kids do experience pain, and if they experience pain, it can be significant pain. It can be significant pain that affects their ability to function, participate in sports, how they live their day-to-day lives, and that happens. It can progress as the curve gets bigger, so it can be quite debilitating, unfortunately. That's why treating the curve in early stages is important.
I knew that it would get worse as if I just didn't do anything to help it, so I decided that I might as well do it early on than later when it could have gone a lot worse. I didn't want surgery because that would have just been months of recovery, and I wanted to still keep on track with school and all the little extracurriculars I have and everything.
When we look at traditional approaches to scoliosis, and what I mean by traditional orthopedic approaches, they have three categories. They do watch and wait, they do bracing, and then they do surgery. Now, once curves break this 45-degree range, pretty much the only option is recommended at that time is typically surgical intervention. So for Sophia, with her size curve, we're looking at a surgical treatment at 12 years old where they're putting rods and screws in the spine and they're immobilizing the spine forever. There is no conservative treatment options provided. No bracing, no therapy, no rehab, nothing. So she elected to treat with me, and we reduced the curve. So we've already altered the course of her spine, meaning we've prevented spinal fusion at this point. And the likelihood of us getting out of her growth phase with the curve below surgical levels at this point is very high. So if you look at the changes that we've made for her and what she's looking at 10, 20, 30 years from now, it's a completely different outlook. This is why we find the care that we provide so special and so important for children.
It's really almost demanding, but it helps so much, and at the end of the day, even if I'm a little tired or anything, I feel a lot better, and I know that it's helping me get better, so it's really encouraging.